All right. Anyway, so here we go. So that would be the left common carotid artery there. That's the left subclavian artery. If you follow these guys upward, then this is the brachiocephalic artery. It's going to branch and give rise to, what's this here? That's the right common carotid artery, and then this guy over here, that's the right subclavian artery. Okay? If you follow the common carotid artery up, it's going to branch and give off what and what? Internal and external carotids. All right? On these models, I don't know if you can really even see them. Hold on. Where did it go? It's a little tough to see on this model, but here's the common carotid. It splits up here. This would be about the spot where the carotid sinus would be. One branch, which is shown here, goes deep inside the skull, and that's the internal carotid. That's the one that's really important. That's the one that's going to go into your brain, whereas this other one stays outside the skull. This is the external carotid, and that goes to do like the skin and the muscles on your head and things like that. You know, this one, you don't want to have either blocked off, but you'd much rather have this one blocked off than to have this little guy that's actually going in towards where your brain is. By the way, that's another terminology thing. Blood vessels that are towards the medial part or the midline of your body are called internal. If they go farther lateral, they're called external. So if this guy didn't have his head turned to the side like he does, you would see the external being over here and the internal being like more like right in the middle. Okay. Let's see. This guy back here is the vertebral artery that's coming up. Actually going to shift over to this side now. So this would be the left subclavian artery. Okay. When you get into the armpit area, it just changes its name and it becomes the what?
Axillary.
It becomes the axillary artery. So this would be the left axillary artery. And then as you get down into the arm more, it changes its name again and it becomes the brachial artery. Okay. So this would be the left brachial artery. There are boundaries, like muscles that that define when it's called what and this and that. Unfortunately, none of these models show the boundaries on them. So if I were to ask, like if I wanted to ask about it being a subclavian, I would try to point up here as close as possible. If I wanted to ask about it being like the axillary, I'd probably point somewhere in like here. And if I wanted to ask about it being the brachial, I'd probably point down here. 'Cause, I mean, I don't want people to miss this question because of like the ambiguity of it. So, you know, I'll try to give you like a very clear idea of where I'm pointing. Okay. Then as you get down into the forearm, helps I guess if you see the hand, but what's this branch here? That's the ulnar artery, and then this one over here is the radial. Okay. Those are pretty much the arteries that you have to know up there. Let me go into the abdomen now. Or actually, let me start there. Wow, that's nice and clear. All right, so again, here's the arch of the aorta. You would then have, the arch goes over, you would then have the descending aorta. You can't really see the thoracic portion of it because the heart's in the way. You'd have to remove the heart and the lungs to see it. But this goes down, and it's called the descending aorta. When it's above the diaphragm, it's called the thoracic aorta. Once you get inferior to the diaphragm, you're then into the abdominal aorta. Okay? Oh, now that's terrible. I can't settle for that. Hold on. Better, I guess. It's not terrific, but... whatever. Okay, fine. So up here is the celiac trunk. Okay? The celiac trunk gives off something called the splenic artery that goes over to the spleen. It gives off the hepatic artery in red that goes over to the liver. Below it, you have, this is the superior mesenteric artery, It gives off branches to most of the small intestine and most of the large intestine. There's two little branches that you don't have to worry about that come off the sides here. Those are called the gonadal arteries. And then this one that's in the midline here, that's called the inferior mesenteric artery, or the IMA. That goes to the last part of the large intestine. It doesn't have as big a distribution as the superior mesenteric artery does. Another artery that you see up here, it's actually difficult to see, is this artery right here. Anyone know what that is? That's the renal artery. That's the left renal artery. You can't even see the right renal artery, but if you could remove the vena cava here, you would see there's a right renal artery that's going over to the right kidney. As you get down here, what would this be? Common iliac artery. What's this branch going in like this?
Internal.
Internal iliac artery. And the one going out here?
The external.
External iliac artery. Now when you cross over your hip bone, it then changes names, and then this is the femoral artery when you're down there. Okay? Can you back it up? All right, good enough. Still kind of dark. So this is the femoral artery as it continues downward. As it goes behind the knee, it's called the what? Popliteal artery. And then as it's behind the knee, it gives off a branch that goes anteriorly called the, what is that?
Tibial.
Anterior tibial artery. And then this one behind it is the posterior tibial artery. That's the main arteries, I think, that you have to know. Let me go over some of the